Early. Thank you.
Yeah. Yeah. I mean, it's up. You're welcome to stay for the entire meeting. It's up to you, but we definitely didn't want to be doing sound checking, in the midst of the meeting.
I appreciate that.
Thank you. So you've got your system all set now.
Perfect. Awesome.
Sounds good.
Turn my volume up a little bit. There we go. Okay, I'll just finish. What happened to everything else?
Ron, check the chat.
Got it, will do.
Hmm.
I'm going to mute so I'm not breathing heavy.
Hi, Paul.
Good morning, Mercedes. Hi, Jacinta. Rebecca?
So we have
Morning, Paul.
morning. We have 6 minutes before 10:30. But Paul, before you're ready to go live and announce the meeting, because it'll take a little time for YouTube to upload the feed.
Okay.
Just give it a pause. Say we're just about ready to start, and then we'll start the live stream before you start the meeting.
Okay.
So give it at least a minute or two, Jay. Right. Recording will start when the YouTube starts, so you can start that as soon as Paul. We'll start both recording and YouTube as soon as Paul gives us the 1 minute, 2 minute warning.
YouTube actually started. So,
YouTube started.
yeah,
Okay, so then we're live.
We're live. Wow.
we're live.
Hello, everyone.
It's always a good day when
No
you wake up
5,
live.
4, 3, 2, 1.
Live.
Live. Live on YouTube.
Good morning, YouTube.
This is really getting to be very difficult. I mean, it's good to see everybody on the screen, but it's not the same thing as seeing people live and seeing that they're well. It was unfortunate that they had to shut the day programs, or will be shutting the day programs next week. I'm sure that was a difficult decision.
Yes, I would imagine very, very difficult a decision, and at the same time, some reaction was quite people really understood that decision, and understanding that if they're going to be visiting with family over the holidays, that's just another way to, not have day program added in that mix. So let's just hope we get through the next 6 weeks with as many people staying well and healthy, and
It's gonna
keep
be
going.
it's gonna be hard for the licensed setting residents. Another well, wow, that's another 8 weeks of isolation. It's very hard to ascertain the human cost of that. But I mean, obviously, that was a very difficult decision, and it's certainly not productive for anyone to second guess when such a difficult decision has to be made.
I agree.
I know it was done under the best of intentions.
Those three little dots. Change virtual background.
I do like the background, Andrew. Whoa.
I think I'm gonna kind of change it up a little bit. I had it for the last meeting, so I think I
Yes.
want to kind of have a little bit of a change up.
Oh, Murda is not feeling well. Sorry to hear that.
Yeah, I just got off the phone with her support folks, and she said she just wasn't feeling well. So I told her we would share all the information with her, but she is definitely under the weather today.
Okay, can we monitor the situation? I mean, obviously, we're all hoping that it's not COVID.
Absolutely, I'll reach back out to her later on this afternoon.
Thank you.
Yep.
And I received a note earlier that Todd is not available. He's having difficulty coming to grips with the anniversary
Good.
family member passing. I know that was a very difficult time for him, and I guess, unfortunately, he is reliving it on the anniversary. We have the governor's town hall at 1 and Partners in Justice at 2.
Okay.
Correct, Mercedes?
Today, I don't have either of those on my calendar. I
You do
have
not?
many
Oh,
other
sorry.
things, but neither
thought
of
I got-
those.
I thought I received a reminder from Celine.
Maybe you could send that to me later. I did not see that.
Oh yeah, here it is from
It might be
yesterday.
it might be a subcommittee you're on of Partners in Justice, not one that I'm on.
Oh no. Alternatives to Incarceration. This is a Rockland County DA's office program for people with intellectual and developmental disabilities. I'll just forward it to you.
Sure.
I guess that's easier.
I'm not sure that I can participate, but I will certainly. I do have my whole rest of the day book solid, as most people probably do by this point in the day. Paul. Hi there, Paul Aronson.
Received that one as well, Paul. The one from the Rockland County.
Oh, do you want that one, Frank?
No, I received it as well.
Oh, you did? Okay.
Yes. That's a 2 o'clock start, right?
Yes.
Yeah, I received that one as well. Thank you.
Okay. Okay, it's 10:31, so we can officially begin. As is our custom, I will commence with did anybody else hear that? Because you're breaking
Jay,
up.
we can't hear you.
Your voice is breaking up.
Jay, you want to type in the chat and I'll relay it.
Oh, okay. Start now. Okay. That's what I was planning on doing. Okay. As is our custom, we'll start out by declaring that this is a public meeting. The basic statement of our state policy on public meetings is pursuant to the New Jersey Public Meetings Act, NJSA 10:4.6. The statute provides, quote, "It is hereby declared to be the policy of this state that the formation of public policy is public business and may not be conducted in secret. Every meeting of a public body shall be open to the public in order that citizens may exercise their democratic privilege of attending and speaking at meetings of public bodies, except as otherwise provided by the Constitution of the State of New Jersey, federal statutes, and the Open Meetings Act," end of quote. Notice of the meeting was filed with the Trenton Times and the Star Ledger newspapers. Council vision. All individuals with developmental disabilities are contributing members of their neighborhoods and communities, make real choices, and have control over their own lives, have the freedom to strive, excel, and make mistakes, are in a position to achieve personal goals, are in a position to affect policy and process decisions that affect their lives, and have the same rights, privileges, responsibilities, and opportunities of citizenship as does every other New Jersey resident. Okay. I want to welcome all the council members. I thank you for your staying current on council business, participating in committees during this very difficult public health emergency. I want to thank both the self-advocates and the family advocates. I want to thank our sister agencies, the Bach Center and Disability Rights New Jersey, for all that they do and their collaboration and assistance and guidance to us. I want to thank the representatives of the state agencies. I know it is very difficult for you to manage your personal and family lives, your job responsibilities while being isolated from the resources that you would have in your offices. And I commend all of you for your hard work and the accommodations and modifications you have been able to institute to give more flexibility to individuals and their families as they struggle with the challenges of the public emergency. So thank you. And certainly I don't want to neglect the council staff who similarly have kept up with the activities of the council while being challenged, I'm sure, at home with family responsibilities, and again, have also lacked access to the resources that would be available to them in the offices. So thank you all. We do also want to thank the public individuals who have followed the council's activities, who have participated through YouTube, and especially all the people who have responded to the NJCDD surveys. The one on monitoring devices, the one on NJCAT. The function of the council is to inform, empower, and represent individuals with developmental disabilities and their families. And we cannot adequately represent you and advocate for you unless we know what challenges you are experiencing and your suggestions for how we can advocate for system change or additional capacity to provide the services that you need. So we thank each and every one of you. We have, let's see, I have to ask for a motion for the September meeting minutes. I can see that Jacinta's waiting for me to do this. So they were distributed.
The motion.
They were just, well, no, I'm asking for a motion, Kevin. Do you want to make the motion?
Oh, yes, I'll make the motion.
Okay, will a member second it?
I'll second the motion, Paul. This is Andrew.
Thank you, Andrew.
You're welcome.
Are there any comments on the minutes, or can we submit it to a vote? Hearing no comments, I'll ask for a vote. You can say aye, raise your hand, and Jacinta, can you maneuver among the screens to assure that everybody's counted? Or do you need me to go and read the roll? I'd rather just do it by acclamation. Okay, please say aye. Unmute and say aye.
Aye.
Aye. Aye.
Aye.
Aye.
Aye.
Aye.
Okay, any opposed? Not hearing any opposed, I declare the motion to accept the September meeting minutes approved unanimously by the council. The next order of business is public comment. Unfortunately, we cannot have people speak because we're not in a hotel room. We did receive one public comment. This was submitted by Nantony Kopstein,
has joined the meeting.
representing the DDAN, the Developmental Disabilities Advocacy Network, the employment subgroup. It's too long for me to read its entirety, so I will read excerpts, but the purpose of this is to remove a major barrier to employment and career advancement for people with disabilities, asking the New Jersey legislature to amend subchapter 9 of NJAC 10:72 as follows. And the subcommittee is asking the council to support the legislation. They're asking for removing the unearned income limit currently at 100% of the federal poverty level, or $1,064 per month for a single person in 2020. Number two, adding the allowance of a grace period. This is for New Jersey workability. Adding the allowance of a grace period of continued eligibility following a job loss. They recommend a grace period of 1 year. As it currently stands, if an individual in New Jersey workability loses their job, they lose that connection to Medicaid and have to reapply for Medicaid. So they're asking for a grace period of a year to enable an unemployed individual to acquire new skills in order to qualify for new types of jobs in the current environment of changing and challenging labor markets. Number three, they're requesting removal of the limit on earned income, currently at 250% of the federal policy level from workability's eligibility requirements. Such a removal would allow workers with disabilities to reach their full earnings potentials and to contribute more to the economy and the public sector's tax bases. Programs in 8 other states do not have such limits. Number four, excluding spousal earnings and resources from the individual's deemed levels for financial eligibility determination. 22 other states only count the individual's earnings and resources in financial eligibility determinations, excluding spousal earnings and resources. And number five, expanding the age limit of eligible individuals from the current 16 to 64 years old by removing the upper age limit altogether, so that workers with disabilities who are 65 and older can continue to qualify for New Jersey workability in order to remain in the workforce. 12 other states do not have this limit. Efforts to achieve this goal are underway in 2 more states. I will refer this to our Public Policy Committee, and I will ask Kara, our new Public Policy Committee Chair, to convene an impromptu meeting to make a recommendation on these suggestions to the Executive Committee. Since our council will not meet again until February, we can refer this to the Executive Committee, which is empowered by the bylaws to act in place of the council when the council cannot meet in full. And I would ask Kara to do this as promptly as is possible, so that we can get a recommendation to the Executive Committee, which can be acted on. And thank you very much, Nantony. I also feel I should note that Nantony has been a very active, knowledgeable, and dedicated advocate, and she has offered tremendous assistance to the council in the area of employment, and has participated in reviews of submissions, applications in response to RFPs for us. So thank you very much, Nancy, and we will take this very, very seriously.
Paul, I just wanted to add real quick that the SILs and other advocacy groups have already supported this proposed legislation. So I think it's appropriate for the council to at least take a look at it, to support it, and not directly lobby. If we can word this correctly, we can support it without lobbying for it as well.
Yes, I mean, all that they are asking is that we put out a statement of support for these recommendations. We are very much concerned about employment opportunities, clearly for individuals with disabilities, and we very much support the state's policy of employment first. So given those guidelines, I think it is appropriate for us to review these suggestions. Okay.
Paul, it's Mercedes. If I could just for 1 minute say 2 things.
Sure.
One is that we do have individuals that are viewing this live segment of the meeting on YouTube. So if we could have anyone who's on YouTube write into the chat there any additional public comments that you would like to make, and we have a second time frame on our agenda where Paul will respond to those public comments, or at least read them and have a discussion. That was one thing. Second is we seem to move into these meetings and sometimes forget about introductions. So again, for people who are on YouTube, if we could just go around, I'll use my screen to call off if people would just unmute, introduce themselves so members of the public know who, and stop moving around. These screens keep popping around, but I'm going to try to do that if that's okay with you, Paul.
Sure.
Okay, so I'm going to start with council members. Helen is the first one I see. So Helen, thank you.
Okay, I'm having problems with my computer. My video isn't working, and I was fussing with that, so I missed what you were calling on me about.
We were just asking for council members to introduce themselves.
Ah, okay.
For the members of the public who are viewing us on YouTube.
Okay, I apologize for the confusion here. My name's Helen Steinberg, and I am the chair of the 5-year plan committee. And I am the parent of a almost 40, next week he'll be 40 years old, a son who has severe level of IDD and uncontrolled seizures. He's total care and lives in a medical group home. And I've, in the past, when he was younger, I was extremely active in a lot of different organizations, and now presently on the council.
Thanks, Helen. John?
Sorry, was having technical difficulties. I'm Jonathan Seafried. I'm Assistant Commissioner with the New Jersey Division of Developmental Disabilities, and I'm very happy to be with you all today on this DD Council meeting.
It is wonderful to see you, John. I miss not being able to see you in the COVID-19 updates. We get your slides, but we don't get to see you. So it's great to see you.
So you have to come to the council meeting to see John.
Yes.
Okay, Kara, thank you. John.
Hi, I'm Kara Kushner. I am a sibling and council member, and I am also the new chair of the Public Policy Committee.
Peg.
Peg, unmute. Peg, you need to unmute.
So she's having some technical there. So Peg Kinsell, who is a public member of the council and works at SPAN. Let's see, Sophia.
Of the Youth Services Subcommittee.
She's also chair of the Children and Youth Services Subcommittee. Thanks, Paul. Let's see, Sophia.
Good morning. Hi, can you all hear me?
Yes.
Okay, great. Hi, I'm Safia Mohammed, parent, member of the New Jersey Council on Developmental Disabilities. I have 3 sons on the autism spectrum, and I am the chair of the ad hoc committee as well.
Thank you, Sophia. Andrew.
Hi, I'm Andrew. I'm a council member and a part-time college student, all virtually. And may I just add that I love this platform for the council meetings, and I think it'd be great to see a lot of people like from around the world to join us. Wouldn't that be great?
Yes, maybe
Thank
even
you.
intergalactic, Andrew. Paul Aronson.
Andrew also serves as vice chair of the Public Policy Committee.
Yes, thank you very much.
Paul Aronson.
Hi, good morning. Paul Aronson, Ombudsman for individuals with intellectual or developmental disabilities and their families. Good to see you.
Thank you, Paul. I see Elizabeth Dazel next on my screen.
Hi, Elizabeth Dalzell, parent of a 27-year-old multiply handicapped child, and I am the chair of the Health and Wellness Committee.
Gwen was having some connectivity issues, but Gwen Orlowski, Executive Director of Disability Rights New Jersey, is also on today's meeting. Jackie Moskowitz.
Good morning, Jackie Moskowitz. I'm the Assistant Division Director at the Division of Disability Services.
Thank you, Jackie. Good to see you and hear you. Kevin Nunez.
Hi, I'm Kevin Nunes, Council Vice Chair, Chair of the current Grants Committee for the Council, self-advocate, person with a disability, and family member, because all members of my family are affected with some sort of disability. So yeah, that's me.
Hey, Kim Murray.
Good morning. This is Kim Murray. I'm the Assistant Director of the Office of Special Ed Policy and Dispute Resolution in the New Jersey Department of Education.
Oh, there we go. Thank you, Kim. And then we do have members of the council who are not yet members of the council, but who have been nominated to the council that have joined us. So I'll let them introduce themselves. Annette, so good to see you.
Oh, so good. So good to see everyone else. My name is Annette Smith. I have been on the Regional Support Planning Council for close to 30 years, and I'm the parent of Tiffany, who is 37 years old, has multiple disabilities, and significant medical needs.
Thank you, Annette. And then I see Ryan.
Hi, my name is Ryan Roy. I'm an autism advocate for people with disabilities, especially within the autism spectrum disorder in Bergen County and beyond the Garden State. I became very much involved with the DD Council. Especially I've known, the executive director, Mercedes Witowski. Both she and I, we participated in the Partners in Policy Making program that used to be through the DD Council, but now, the Bog Center took over a bit. And now we're actually working together as colleagues, and I'm looking forward to really be a part of this meeting. I wear many hats, by the way.
Thanks, Ryan. Good to see you. And Kyle Pacone.
Hello, my name is Kyle Pacone. I'm a council member for the DDD, and I known Mercedes from quite some years ago, and I'm pretty much humbled to be here with as a council member in a meeting to discuss what can we do for New Jersey Council of Developmental Disabilities on the autism spectrum disorder.
Thank you, Kyle. And I did see Sarah Aziz earlier on the screen, and now she's gone. But Sarah is also an individual nominated to the council. If she comes back on, maybe we can do a quick introduction. Oh, you are Sarah. Go ahead.
Hi, Sarah.
You need to unmute, Sarah.
Hi, I'm Sarah Aziz. My nomination to the NJCDD recently got confirmed by the New Jersey Senate on October 29th, but I'm still waiting the official paperwork to get onboarded onto the council. So the process is ongoing. I'm glad to be here and to see all of you.
Okay, and then we do have council staff. If you don't mind, I'll just run through them because I don't want to take a lot of time for the mute and unmute process that I don't know that we'll ever get and figure it out. But we have Bob Titus, public policy, Frank Latham, People First and Youth Leadership, Gary Brown, Communications, Jacinta Williams, Administrative Assistant, and everything else in between, Jody Fox, Finance, Rebecca Novemsky, Family Advocacy. I'm just looking, and I hope I got everybody. Thank you all for joining us. Oh, and Kyoko Coco, also Family Advocacy.
I would just add that Jacinta is irreplaceable because she has to do everything that nobody else is assigned to do. So she doesn't have a limited job. Her job is unlimited. And we could not survive without her. I'm going to try to keep this
Excuse
brief.
me.
So,
I'm sorry. I just wanted to announce Phyllis Melendez is also here. I'm special assistant at the New Jersey Family Care Program, which is the state's Medicaid program as well.
Welcome.
And thank you very much. I just wanted to make sure I was.
Thank you, Phyllis.
People
Yeah.
knew I was here. Thank you.
Thank you. Appreciate
We're
that.
delighted
Sorry,
to-
but the screen kept bopping around, so appreciate that.
Of course. Thank you.
so
And I
much.
also want to say, in my personal life, I do have a son, 12-year-old son with cerebral palsy. So thank you very much.
Thank you.
Thank you. I'm going to focus my remarks on two specific items. We are very much concerned about the health and safety of individuals with developmental disabilities. The statewide Family Support Planning Council has formed a health and safety subcommittee to address these issues. And since nobody else wanted the job, I volunteered to be the subcommittee chair. We've met several times, and we have participated in 2 webinars, and we will be participating in a third one. These are being run by an organization called HRS, which I guess is Health Resource Services, something like that. But they run informational webinars to train people to promote the health and safety of individuals, primarily those being served by licensed programs. Our objectives are to identify best practices throughout the country and to encourage their implementation in the state of New Jersey. Our group has met with Jonathan Seyfried, and Jonathan was encouraging us to pursue our objectives. I've also spoken individually with the heads of the 3 trade associations, and they have also indicated their interest in working with us. And I've spoken with Jennifer Langer Jacobs, the Assistant Commissioner and Director of DEMOS, and she has indicated her willingness to participate as we need her assistance and guidance. There are 2 areas that I wanted to address. One is integrated care. Individuals with developmental disabilities tend to have more than one simple diagnosis, and very often they're treated for symptoms by different doctors, and nobody really gets to the underlying cause of their health needs. We think that a more integrated approach, where rather than having 3, 4, 5 doctors treat symptoms and each one prescribe 1 or 2 medications, and pretty soon an individual is taking 8, 10, 12, 15 different drugs, and nobody really knows how they interact because there just aren't enough people taking that exact mix of 15 or 12 drugs. We have been introduced to a model that's used by Dr. Matthew Holder at the Lee Specialty Clinic in Louisville, Kentucky. Dr. Holder is a former president of the American Academy of Disability Medicine and Dentistry. He was the keynote speaker, I believe it was 2 years ago, at Bev Roberts' ARC of New Jersey Mainstreaming Medical Care Conference. I spoke with Dr. Holder at that time, and he indicated his availability and willingness to advise and help New Jersey. I've subsequently participated in 2 webinars that he did for AADMD, and the last one was just about 2 weeks ago, and he again indicated his desire to implement his model in other states. Quite simply, his model provides medical care, um, mental health care, or at least behavioral meds, and dental care and therapies, all in the same facility, with a team that works together to develop an individualized treatment plan for each individual. The benefits are the integrated care personalized model yields better health, better safety, better lives, and also saves money because you're not seeing so many different doctors, you're not taking so many drugs, you tend not to get sick as often, and it really eliminates costly trips to the emergency room. So it's kind of a win-win for everybody. Better health, better lives for individuals. It makes it easier for providers to provide services, and it saves government money. And I'd like NJCDD to sponsor a focus group where we would bring together Dr. Holder and his team, family advocates, self-advocates, state agency people, practitioners of the medical specialty and dental specialties, and academic experts, as we did for the dual diagnosis task force. I think that would be very, very helpful. We had at least 12 state agency people at the dual diagnosis focus group, and I'm hoping that this one would be just as informative and thought-provoking. And it also brings different stakeholder groups together, which I think is very, very valuable. The second item I wanted to address is training. The webinars that we have attended were basically focused on what HRS calls the fatal five. These are 5 conditions that are sometimes, unfortunately, the cause of preventable deaths. It's aspiration, bowel obstruction, dehydration, GERD, and seizures. And what we would like to see is training for DSPs to recognize early signs of one of these maladies before they reach the stage where they are threatening to the individual's health and safety. HRS does some of this training online. The state of Louisiana has developed a curriculum with provider cooperation, but we need state assistance. We could adopt the curriculum from HRS and Louisiana, but we would need professional trainers to train the DSPs, and this would require upfront funding from the state. The bargain here, though, is that if you do this, you greatly improve the health and welfare of individuals, which decreases the cost of caring for them. In the long run, there would be a substantial savings to Medicaid, and what I am proposing is that we ask the state for a waiver amendment for a demonstration project to show that by providing this training to DSPs, we would reduce the healthcare costs to the state and to the federal portion of Medicaid, similar to the demonstration project, the pilot project that the Camden Coalition of healthcare providers did in obviously Camden, whereby providing services that were traditionally not covered by Medicaid, they achieved substantial overall cost reductions, primarily reduced trips to the emergency room, which are very, very costly. So I will bring these items up at our next meeting of the Health and Safety Subcommittee. And we also had a wonderful session yesterday, sponsored by Bonnie Bryan, who really was the mover and shaker to get HSS started. But she brought together a whole host, several dozen family members and self-advocates, and they testified to their experiences on the need for training and other modifications to the DD services system to increase accountability and make sure that all programs are of appropriate quality to guarantee or at least ensure the health and safety of the individuals who are being cared for. So I really just, rather than rambling on about a lot of things, I really just wanted to focus on the two most important things that I have been working on, and that I hope the council will be instrumental in bringing to fruition. I'm going to next introduce Kara Kushner, who is the new chair, and I'm delighted to have her aboard in that position, the new chair of the policy committee, and she's fresh off chairing her first meeting, which I thought was very well done and very informative and productive. And also thanks to Bob Titus, who serves very ably as the staff support for that committee. Kara, take it away.
Thank you. I definitely want to echo that. I could not do this without Bob's guidance. So thank you very much, Bob. At this time, since our last committee meeting and really over the last couple of months, the updates from our committee are, first and foremost, of course, we've seen a resurgence, especially lately in COVID-19 and that pandemic. It's really hampered communication and disruption to the lives of all individuals, and especially individuals with IDD and their families. So we're going to be continuing to monitor how the pandemic affects day-to-day life, and as well as the stagnation that's occurred, unfortunately, with a lot of legislation and administration that we would like to see of different programs and supports for people with IDD. So we're going to continue to monitor that. At this time, the approval of the state budget on September 30th did occur. It was anticipated by a strong campaign in the summer to convince the governor and the legislator to adopt no cuts. So this budget really was a big push. We know, especially during a pandemic, we don't want to lose funding. So we were asking to not cut funding for the needs and the needed services and supports. And it was inaugurated to do this campaign back in August. And it was praised at the national level during a webinar in October, this campaign that was pushed forth in New Jersey for no cuts. So we're very happy about that, but we need to continue to advocate, especially as the pandemic wages on and we see how things are affecting our individuals and our families and the self-advocates' lives that we're hearing from as well, just how the pandemic is affecting services and support. So we need to continue to advocate for funding and that we don't see any cuts to budgets in the future, but also the way programs are administered and the way funding trickles down in that regard too. So we're going to continue to watch that. In addition to this, a really positive note as well is that the Disability Caucus Plan that was developed with ABS has progressed steadily, and it's a kickoff event actually next week on December 1st. And Senate President Sweeney has agreed to chair the event, as well as other individual legislators are coming. So we have a lot of participation with advocates coming as well. And it's exciting that we're going to really be pushing the dialogue along and really providing, legislators with needed input on how to keep individuals with IDD and their families, sorry guys, in their minds when they're reviewing and developing legislation. So the series of virtual meetings have been scheduled quarterly for the year for 2021, and we're really looking forward to how that's going to continue to really just promote the integration and consideration of our constituents, really the people we care about most in the conversation when it comes to a wide variety of policies that are being developed that people don't always consider the impact that can be had on individuals with disabilities and their families. So we're hoping to have that be a really great start and continuation of the work done across the state from a policy perspective. Back in October as well, the council provided testimony to a special hearing of the Assembly of Human Services Committee on abuse and neglect in congregate living. This speaks to a little bit of what you just spoke to, Paul, as well. The testimony highlighted the need for decisive and immediate action to recognize not only human rights, but to advance laws and regulations that provide an opportunity for really accountability and enforcement of staff supervision and training. And really the goal is not only having appropriate response to situations that occur and really talking about the need for that, but also preventative measures, as what you're kind of indicating, Paul, that we need to be really thinking about how we can prevent these things from happening. And a big part of that really may be training. So that's been a big push as well, is to continue to discuss that. Unfortunately, a lot of the testimony that day, it was very hard to hear and very important to continue to discuss, that the human rights of individuals with disabilities are continuing to be protected. This time, the committee has drafts of position papers as well for housing, healthcare, and transportation, and they're ready for discussion. And we are continuing to monitor pending legislation and delays in legislation due to the pandemic, including the school safety bill, bill on disability employment, council membership, SDE overtime, assistive technology, and restroom signage. So there's a lot going on, but it's moving slowly. Some of it's sort of sitting just because of the nature of what's being at the forefront right now. But we're continuing to monitor how things are going and providing input as needed. And we've also been examining Billy Cray's law and had both proponents and opponents of this pending policy before our committee. And we've sought input on electronic monitoring as a council via a survey that was sent out. So we're hoping to get, we've had, from my last conversation with Mercedes, we've had a lot of feedback on that, a lot of input, which is, it's great to see. So we're hoping to get back that information, because from our own discussion, there's been a lot of variance in due to a lot of factors on electronic monitoring. So it's a delicate issue and there's a lot of variability. So we're going to continue to see where everybody's positions are and the information we get back from the survey. And we're going to continue to monitor federal legislation, specifically of interest related to a COVID-19 assistance bill, and see where that goes. A lot of our work right now is continuing to monitor things as they've, like I said, stagnated, and continuing to look ahead and see how the pandemic affects individuals with IDD and their families. But one of our subcommittees, the Children and Youth Services Subcommittee, has had a lot going on recently. And I'm going to I wanted to ask Peg Kinzel to sort of speak to some of that, because I think that's very important from a policy perspective as well. So Peg, can you give an update too on some of the initiatives that have happened recently with CNY?
Yes, I'm here. Can you hear me, Kara? Okay, good. So I apologize for not having my picture up there, but with the last disaster of not hearing me, I'm going to try just to unmute, and you'll have to imagine how wonderful I'm looking in my pajamas at my house. But anyway, I just the council got a brief update on our activities, and so, but I just really wanted to kind of zone in on a couple that have been actionable and that we had to address right away. One of the issues was the state Supreme Court Committee on Unauthorized Practice of Law issued a decision that we thought was an overreach, to say the least. And without going into a whole lot of detail, one of the factors was that they felt advocates were committing an unauthorized practice of law by attending IEP meetings with families and supporting families or speaking on their behalf, both in IEP meetings and mediation. We do know that IDEA gives families the right to choose whoever they want to bring to an IEP meeting with whatever expertise they feel is necessary. So the council, along with SPAN, along with the Education Law Center, and quite a few other advocate and disability rights, issued comments to the committee. They took comments until November 16th. And quite a few national organizations weighed in as well, because they also felt that the overreach of this committee was very dangerous and certainly didn't want them setting any kind of precedent. So to be determined, I will update you as soon as we have hopefully good information on that. Another issue that we had to react to pretty quickly is that the United Healthcare Community Plan has decided to terminate its contract with CHOP as of December 1st. And CHOP doesn't have any full participation agreement with any other New Jersey Medicaid plans. So that means New Jersey families of children with complex medical needs will not be able to access the most famous and foremost children's hospital in our area. And there's a whole lot of I don't know, I'm not even gonna say that 'cause it's not true. We don't understand what the rationale is. They accept Medicaid costs. The access, especially in Southern Jersey, is critical. If you have 4 or 5 specialists under one roof, you want to be able to access them and not have to have fragmented care all over the place. And the other thing is that we think there's a discrimination piece because this is not true of their private plans. It's only true of their Medicaid coverage, and that is a huge problem. We've written to the governor's office. We're asking advocates, family members, or anyone else that has an interest in this to make sure that the governor understands what the impact of this could be. And the other thing I wanted to mention quickly was that OCR's issued, we have done a lot of work and we're still trying to do a lot of work on reducing the use of restraint and seclusion. OCR has released its latest report with the 2017-18 Civil Rights Data Collection. And unfortunately, students with disabilities continue to be restrained and secluded at rates that are significantly higher than their peers. It's not a big surprise, but it should be an abhorrent surprise. The good news is, though, that the federal legislation Keeping All Students Safe Act is being reintroduced, actually, I think today. And even though it's going to be reintroduced in lame duck, the main purpose is to try to get as many additional co-sponsors onto that legislation as soon as possible. And I have one other little good news that Assemblywoman Stanfield has introduced a bill A5025 to establish a bridge year pilot program. The legislature passed a bridge year pilot program already, but it was for students 19 and below. So our students that are remaining in school to 21 weren't entitled to this bridge year, even though obviously the students that got left out of their transition supports and all those other critical learning and exposure experiences were just not available because of the pandemic. So we advocated really hard to try to get some extra time minus just compensatory education. And we had a little bit of success with the department, but not as much as we wished. So hopefully this bill may be, will help along those lines. The only other thing is I wanted to thank Sophia because we had a really good ad hoc committee meeting, and one of our issues on children and youth is also disproportionality and overrepresentation. And unfortunately, New Jersey Department of Ed just issued a report that, the students of color are 3 times the rate of white students of suspensions, and that suspensions have been up 11% in both in and out of school suspensions. So that's something else we'll be digging into and asking our sister committee, our ad hoc committee, to work with us on. So that was as quick as I could do that. And I appreciate your attention, and Kara, appreciate your support as well.
Yeah, thank you. We appreciate it. And the last thing I want to say for the policy committee is that I will send out with after I communicate with Bob, I will send out a request for the policy committee what would work to have and convene a meeting regarding the concerns brought up in the public comment section this morning. So that's it for my report. If there's nothing else, Bob, that you need to address that I didn't address, I think that's it.
Just want to acknowledge again, Paul, with your support and coming up with the idea of the legislative caucus, how important that is. Thank you. I know Mercedes and ABS have worked tirelessly on this. We have literally half the legislature as founding members of the caucus, which I think is terrific. And also the collaboration group that originally met in 2019. I think almost all now are in as what we're calling, I guess, founders of the caucus. So that includes ABCD and NJCDD and DRNJ, and the rest of you guys know who you are. Thank you all so much for your cooperation, and we're looking forward to really good things coming from this caucus. And it's also been a real pleasure working with Kara. It's there is, I mean, as Peg knows and has said, you can talk about this stuff all day. So I will end now and just thank you all for your support.
I just want to add one thing. This idea was not mine. This was just an idea that I got from the folks in Ohio. And this is a point that I tried to make earlier. The best ideas we're going to come up with are not going to be original ideas. They're just going to be things that have already been done elsewhere.
Yeah,
So,
Paul, I was there with you at that disabilities conference. Believe me, this is way beyond. I talked to Ohio right after that, and this goes way beyond what they were doing.
yeah, no, I mean, we've gotten far more buy-in from legislators, so we thank the legislators. But the idea basically, I think the best ideas we're likely to come up with are going to be things that have already been implemented elsewhere. And we really have to focus on learning from the other states, how they've solved the challenges that we're facing, and then just try to adapt, come up with to the particular needs and resources here in New Jersey. Let me turn this over for the Grants Committee comment from Kevin Nunez.
Paul,
Yes, Andrew.
before we move on to the next topic, I just wanted to echo Bob's comments and say thank you for your work in getting this caucus together for the different agencies, the different players at the table who will be, so instrumental in helping us and people with disabilities. So I just wanted to thank you for that, and working with Ohio to get it going in New Jersey.
Okay, Kevin.
Yes. Hello. Can you hear me?
Yeah, barely.
Okay. Well, I'm Kevin Nunez, Council Vice Chair and Grants Committee Chair as well. I'll go over as quickly as possible the activities of the Grants Committee over the last year. One of the things we did early on this year to help our constituency with the pandemic was to create the emergency fund to keep individuals engaged during quarantine and the stay-at-home order issued by Governor Murphy. That was definitely our biggest thing. If you look at our current 5-year plan, the grants coincide with the 5-year plan, and I'm happy to say that as the 5-year plan is ending, so is the current grant cycles. For example, the oral health report and diagnostic done by Columbia University and Baker Street is done and completed. You will find versions in both English and Spanish on our website. We also did a grant with the Span SEWA project that has also ended. I'm happy to report that they received additional funding from outside sources to continue their work. So that's always good to know. Most of our projects have ended. I won't go into every single project. The mental health dual diagnosis crisis to handbook also ended as well. We did have a few extensions due to COVID, mainly transportation with Best Buddies and employment received 2 extensions due to COVID and because they were unable to complete their work due to the current situation. In your council materials, you have my full report as well as all the numbers and figures. I just don't want to take up as much time as because I know we're tight on time as we are. So I don't want to keep anybody too much longer. But I just want to say that the staff has done a tremendous job managing these grants and making sure they've been monitored for the last year. It's been very difficult, but I'm happy to say that a good 95% of the current grants we've issued have been completed, even in spite of the emergency situation that we have all been living in. There's one last thing I wanted to bring up. I wanted to, because it's been a long time since we've done this. As far as our own accountability and our own resources, we should always look to improve. So I would like to create a motion or ask. Well, I'm gonna make a motion to create an ad hoc committee to revise and edit the current bylaws, and have a draft presented to the council at the February meeting. I think we should really do that. So I'm making a motion to create an ad hoc committee to revise and edit the current bylaws.
Okay, thank you, Kevin. Thank you again for all you do. I know you're always available and always willing to help out when we need to get something done. I think we will form an ad hoc committee in 2021 to do our next review of the bylaws. I would appreciate it if anybody who is interested in serving on a review of the bylaws committee would send me an email so I have an idea of who is available and who is willing to work on that project. We were fortunate the last time out. Joe Young took the lead on that. So please, this is any and all council members are welcome, self-advocates, family advocates, as well as the mandated positions.
Pardon me, Paul. Would you be able to send out a narrative as to what is entailed with what would be entailed if one were to join the
Sure, we can do
bylaws
that.
committee?
We can do that, Andrew. Yeah.
Thank you.
Could I ask for a second on the motion?
Kevin, the bylaws clearly state that it is the prerogative of the chair to form an ad hoc committee.
Okay,
so let's leave it at that. And I'm asking for, I think we have followed the practice of periodically reviewing the bylaws. I think it's time to do that. But I would like to get an idea of which council members are interested in volunteering for that effort.
Yeah, it's been about 4 years to my calculation.
Yes,
I think
it was done in
time.
2017.
Hi, this is Sophia. I hope you all can hear me.
Yes.
I would like to recommend that we amend Kevin's suggestion or his motion to create an ad hoc committee to revise the bylaws. Is it within our bylaws or is it within our responsibility as the council at large to take a look at the bylaws?
I don't really think there's a controversy here. We are going to empower a committee, as we regularly do, to review the bylaws. I'm really just trying to put the horse before the cart and trying to get an indication of who's interested in volunteering for this project. And once we get an idea of who's interested, we can form an ad hoc committee give it the mission of reviewing the bylaws, recommending changes to the bylaws, and then whatever recommendations the ad hoc committee makes would be reviewed by the full committee and voted upon by the full committee, the full council, excuse me.
If you want me to take the lead on that, Paul, as the vice chair, I'll gladly send out the email later today. Just to see who's
It's okay, Kevin. I can do that. I mean, I'd like to get an idea of who is interested. And again, this would be available to all council members, and I would appreciate if we could get some participation from our sister organizations or state agencies. That would be terrific. And there's no limit to the review or to the recommendations that this ad hoc committee would be able to make. Just understand that whatever the committee recommends has to be voted upon by the full council.
Paul, when are we looking at like the timeline of when we'll start reviewing the bylaws? That'll be next year, or?
I would hope that we could start this as soon as I get an indication of who's interested in engaging in this work.
Okay.
I would hope that this is not something that I would like to linger. Hopefully, I would like to think it's something that could be done in the first, would be completed by the end of the first half of 2021. But again, that would be a decision of the ad hoc committee when they feel that they are ready to make their recommendations to the full council. Might not be a bad idea to submit it first to the executive committee. But again, that would be up to the ad hoc committee. The only fixed rule is that the final product has to be debated and approved by the full council. Okay. I'm going to introduce Helen Steinberg for the State Plan Committee, but first I want to encourage all council members to consider participating in this process. I don't want to get into the position that we're in the last time this was done, where too much happened too late in the process. Helen and Brenda have done a lot of work, and they have a clear timeline. We had 9 subject areas. There were 3 subcommittees. Each subcommittee had 3 areas. I know there were a lot of people who either did not have the time to participate in one of the subcommittees or an interest in all 3 of the issues that each subcommittee had. So I encourage you, even if you're only interested in 1 or 2 of the 9 issues and they weren't blocked together in a subcommittee, please send your input to Helen or Brenda, because I'd like to get as much of the groundwork done so that we don't have any trouble getting to the fixed schedule, because this is something that has to be done and voted on in final form by the council in August. It has to be submitted to the state, and then it has to be submitted to the Fed so that it's effective, and so it's approved by the end of September and is effective on October 1st as the guide for council activities for the 5-year period starting October 1st, 2021. So please don't wait for the last minute. Think of subject or subjects that you're interested in, and review the materials that the planning committee has distributed, and send your comments to either or both of Helen and Brenda. So go ahead. I'll turn it over to you now, Helen. Have we lost Helen?
Nope, I'm there.
Oh, okay.
Sorry, I'm having a lot of problems with my computer today. The video isn't working and my mute button doesn't always cooperate. Anyway, Brenda Considine, Considine Communications, and I have been very involved together with things, and she's been doing a fantastic job. Considine Communication Strategies, which I will refer to now as CCS, has continued to work with the NJCDD to facilitate the development of its 5-year plan. CCS ensures us that the plan is being
A
developed in
participant
compliance.
has joined the meeting.
Ensures us that the plan is being developed in compliance with the requirements of the DD Act and will include comprehensive review and analysis, plan goals, assurances, public input and review, consultation, and designated state agencies. Currently, we're in phase 3, which is going from May through January, and that's the development of plan, envisioning the future. There were 4 more work groups since September 24th, since the September 24th council meeting. The groups were special education, healthcare, wellness, and safety as one group, discussing barriers, including policy practice, funding to services, opportunities for innovation, cross-cutting issues, priorities, and activities. Next, the employment transition, transportation, and that's review data and public input, group discussion, personal experiences and perspectives. Third is an ad hoc committee to ensure equal access to DD services, which was formed with Chair of Sophia Mohammed, and we'll give her report when I finish mine. Last is employment transition, transportation, discuss barriers, including policy, practice, funding to services, opportunities for innovation, cross-cutting issues, priorities, and activities. Pardon my voice, some sinus problems here, giving me trouble with my voice. CCS is currently reviewing all the data, research data, survey, public comment, focus group reports to look for threads, themes, and trends. This will be reported to the council in January at a special meeting. At this special meeting of the council, we will more fully engage council members, especially self-advocates and family members, in the planning process. And as Paul said, we really do want the participation of more of the council members. And that's the end of my report, and I'll turn it over to Sophia to do her report.
Thank you, Helen. Good morning, everyone. This is the ad hoc committee report for the periods of July 2020 to November 2020. On July 16, 2020, New Jersey Council on Developmental Disabilities Chairperson Paul Blaustein established an ad hoc committee to ensure equal access to DD services, developmental disability services. The council chair was appointed Sophia Mohammed, which is me, and I accepted. On August 20th of 2020, the council chair announced to the DD Council at large the establishment of the subcommittee, which would serve under the planning committee. On September 30th, 2020, the ad hoc committee convened the first meeting information session, beginning a dialogue about gaps in service delivery and identifying potential areas of focus. 24 participants attended via Zoom, only one of which was a self-advocate. On October 26, 2020, the New Jersey Council on Developmental Disabilities Chair facilitated a debriefing with myself, Sophia Mohammed, the Public Policy Chair, the Planning Committee Chair, Helen Steinberg, the Council Vice Chair, Kevin Nunes, the NJCDD Executive Director, Mercedes Witowski, and the Council Consultant, Brenda Considine. Sophia, myself, the Council leadership, and enlisted stakeholders sought recruitment of self-advocates to participate and lend their voices to the ad hoc committee. On November 18, 2020, the ad hoc committee convened the second meeting via Zoom with 23 in attendance. 3 self-advocates attended this meeting. 5 areas of focus were identified to be incorporated in the 5-year plan, which are exploring intersectionality of race and disability, explore economic inequities, facing disabled workers, increased grant opportunities awarded by the New Jersey Council on Developmental Disabilities to underrepresented communities, increased outreach initiatives within underserved and under-resourced communities, promote educational initiatives that address the impact of being both a member of underserved, under-resourced communities and having intellectual and developmental disabilities. The ad hoc committee will convene again on December 16th of 2020. And that concludes my report.
Thank you very much, Sophia, and thank you again for taking on this assignment and getting things up and running so quickly and recruiting so many members. This is a very difficult assignment because of the time frame. We really need input to go into the 5-year plan, and unfortunately, the 5-year plan has to be done by the end of August. So I really do appreciate you're taking on this assignment and taking it so seriously. And especially, I know you've made major efforts to recruit self-advocates to be members of the committee. Terrific job. Okay, we've gotten through the reports. I think I'll turn it over to Mercedes to introduce the grant update.
Thank you, Paul. So one of the things that we've also been missing in our not being able to have longer meetings and meet in Hamilton in person is opportunities for our grantees to provide an update to us on the status of their work. So in an effort to squeeze as much into this time frame as possible, we have asked for a brief report, and we're very pleased to have with us today Matthew Fernandez, who is the New Jersey State Director for Best Buddies International, who will provide a report on the grant that they were awarded. So thank you, Matthew, for being here. We look forward to your report.
Thank you, Mercedes, and thank you, everyone, for having me here, and without a doubt for supporting our program here in New Jersey. The council support has been instrumental in providing a really positive impact for our participants in our program this year, especially. Also with me, I believe, is Lisa Dirks, is the Best Buddies International Vice President of Government Relations. Lisa, you want to say hi?
Hi,
Yes.
hello, hi, thank you, and thanks to everyone on the council. Just as an aside, I actually sit on the Maryland Developmental Disabilities Council, so I'm not too far away from you.
Fantastic. So it's good to find faces on this thing when everything's moving always around. So I give kudos to Paul, especially for doing all of that. So thank you, everyone, again, for having us here. Best Buddies is a global nonprofit. We're in 56 countries around the world and in all 50 states in the US here. Our mission is to establish a global volunteer movement that creates opportunities for one-to-one friendships, integrative employment, leadership development, and inclusive living for individuals with intellectual and developmental disabilities. Locally in New Jersey, we're celebrating our 3-year anniversary of having state operations, whereas globally we're 31 years old as an organization. In New Jersey, we have just over 820 participants in our programs, whether it be our leadership development program, our friendship programs, or our job and integrated employment opportunities. New Jersey is one of 16 state offices to partner with councils across the country as well. So thank you for that, and to your peers as well across the country there. Part of our plan this year, when we had a fantastic plan up until March 13th to have a lot of in-person trainings, a lot of in-person internship experiences for our participants. Needless to say, a lot changed this year. Part of the council's priority was the employment, and part of your 5-year state plan was to focus on the employment and using best practices. In Best Buddies New Jersey, we worked with some of our other other states and other partnering organizations to find that best practice and implement it here in New Jersey in this pilot program. Our original plan was to have a 6-week intensive program, 1 week of the pre-employment trainings delivered around in person, 5 days for 20 hours total. That was not able to happen in that time frame as well. We modified that 1 week intensive to actually a 10-week delivered program that we did a couple hours every week with our participants. The 5-week internship was able to maintain that part with around half of our interns being in-person on-site internships, and we had to also make some modifications and we were able to adapt to have virtual internships, which came out to be very successful and kind of open a lot more opportunities for some of our participants as well. We did lose a few of our host sites for the internships. For example, the Trenton Thunder didn't have a season, really didn't have a lot of internship opportunities for us in that space. A few other sites that we were excited to partner with, the College of New Jersey, they weren't allowing individuals on site as well in that space. On the other side of it, we were able to add more opportunities, with one of them in particular, Anheuser-Busch. We were able to have several interns there because it was a virtual internship. Several of our participants had expressed concerns, obviously, to being in public spaces and dealing with the pandemic here. So being able to offer those virtual internships provided to be really strong for them. And I like to focus on the Anheuser-Busch one specifically for a second, because normally that internship would have been going into their Jersey City location, doing a lot of office support and HR support in that internship. Because of the fact it was a virtual one, they got to collaborate with individuals across the globe on a very unique project. They ended up presenting as the last part of their internship to the Senior Vice President of Human Resources for Anheuser-Busch about how they can make Anheuser-Busch a more inclusive workspace. And their final suggestion was to create a intellectual and developmental disabilities employee resource group to support their individuals. So that was something we were very excited about. They had an opportunity that they typically would not have been able to have in that space. Another modification we made that we able to be proud of is we added in part of the pre-ETS some components about online professionalism and cybersecurity. Parts when they were doing some in-person internships, they wouldn't have to deal with that as much, but we worked with them a lot on that space. The other difficulties that we had to overcome were when we were doing our main recruitment for this program that was slated for April and May. Obviously, in New Jersey, there was a lot going on in April and May, and working with our partners at DVR, our partners in some of the schools, there was a lot of other priorities on their plate, so we had to modify how we did a lot of our outreach in working in that space. We worked a lot with the council here to get into some of the newsletters, to work with some other referrals. That's why some of our Bergen County DVR offices, that's when they had their peak during the April and May with the COVID cases. A lot of those interns didn't really get recruited in until the summertime for the fall internships, where we have interns currently right now. Also, we were very proud of, we have 3 of our 5 interns. Our goal was to place them in permanent placements. 3 of them to date have been placed still, even with everything that's going on. So we're very excited about that. We did have a 4th that was also to get placed, but they had to delay it due to a COVID diagnosis for that participant. But they're doing better, and we're happy that hopefully the opportunity will be pushed for next year for them. So fingers crossed on that one. I'm trying to think of, a big part of having to work a lot on job carving. A lot of the internships were for in-person internships, and we had to work with the employer partners and the host sites to modify, to create what a virtual internship would look like. A really good partner with some of these opportunities was Hackensack Meridian Healthcare. We had individuals at Carrier Clinic, individuals at various hospitals doing very, very different roles than we had originally planned. But it was actually something that turned out to be for the best for a lot of our participants. One of our individuals went in thinking we would do some office support, they started working on food services instead, and they developed a passion for it. And they were one of our first individuals hired by Flick to do food services at Merck location there. So we were able to work a lot in that space. We have the last 3 of our interns actually starting next week on their placements, which will bring us to the full 25 interns to be served during this program. That's something that we work with, and able to work with a lot of different high schools and work in different spaces there. The other kind of hurdle we had was we had some technology fatigue, we like to call it, in a lot of our students who went virtual in March and then did extended school year in the summertime and in the fall, adding on another 10 to 20 hours of screen time was difficult. So we tried to spread that out a little bit more to try to space out some of that fatigue on the technology there. That is what I have. I don't know if there's anything else we'd like to add in on that part, Lisa, but thank you.
I think that was a good job, and thank you so much to the council for your support of this project. We're excited with the success we have been able to have despite the challenges, and we are hoping to learn from this and utilize this as a model for some of our other states to implement something. So you're serving a really important role in funding this opportunity. So thank you.
I want to thank you both for presenting as chair of the grants committee. This really shows the work that the council does. A lot of people, you think we just talk a lot, but this is a good example of tangible work that has been done to improve our community and overall perspective of individuals with disabilities. Thank you.
Thank you, Matthew, and thank you, Lisa. We appreciate your being the first grantee to report in this way, and we are excited at the project, even though it had its delays, and we were able to initiate a grant extension. You really have moved forward with the objectives, and as everyone has adapted in this environment, so too have you and the individuals who have completed their internships. I'm sure it's been as rewarding as if they had been all there in person. So thank you very much.
I'd also like to say, and again, give credit to Mercedes, that prior to her tenure, council projects tended to be reports that were filed away and never read. And this is a better example of what we're trying to do, to actually do pilot programs that can lead to system change, better lives for the people we serve and represent. And I think we've really turned the corner in being able to organize and maintain much more productive and effective projects. So thank you very much to Mercedes, and also to our contractors, especially today, Best Buddies International. This is, a leap forward for the council. We're just delighted to be able to have you doing this for us. We had an opportunity to reinstate our advocate caucus. We used to meet with the advocates, the self-advocates, the night before council meetings, and we stopped doing that, unfortunately, when we started doing virtual meetings, because we were not together in the hotel for dinner the night before. But we reinstituted that, with our apologies to the self-advocates, because we really should not have discontinued this. But we had a very productive session. I guess it was 2 weeks ago, and Andrew has volunteered to present the results of that session to the full council. As is our custom, we ask one of the self-advocates to volunteer, and they kind of rotate the assignment. But this way, we get both the benefit of viewpoints of the self-advocates, and we're able to communicate them to the full council. So go ahead, Andrew, please give your report. Andrew, you're on mute.
I'm here if anybody needs me.
Okay.
He's Andrew Harris.
Sorry about that.
That's okay.
So, Paul, I wanted to thank you for that warm introduction to the report. And then I wanted to also thank Mercedes for helping me to put the report together, because without her help, I wouldn't be able to report out to you what we talked about. So the first kind of item on the agenda or on the report is the electronic visit verification, or the EVV. The implementation of that is coming down the pipeline soon to New Jersey, and there is a definite lack of good information available, or viable information. So we had talked about, through the Consumer Caucus, establishing a committee, an EVV committee, whereby advocates and parents and families and professionals and other agencies could talk about and bring their ideas about the electronic visit verification. So that is very much a consideration, and it is in the pipeline for the future. The next item we talked about was general self-advocacy, and how can we as the council assist people first chapters and advocates across the state level to expand their work and discussions based on statewide efforts, as opposed to only local level advocacy. So we want to kind of expand our reach as the council and look into other avenues, not just at the local level, but other possibilities as well. So that's what we talked about there. And then electronic monitoring devices, camera legislation. We sort of discussed back and forth overall advocate discussion related to privacy and equal rights. And advocates would then be encouraged to complete a survey based on their opinions and whether or not we thought it would be effective and a good course of action to move forward with that. And then we decided through the committee that the link would be shared with the full council so that we can get feedback from everyone there as well. And then the fourth and final topic that we talked about was support coordination and how they play such a vital role in the state, especially during these challenging times. And we need to acknowledge their role and importance in the lives of people with disabilities and their families and those who support them as well. So that's kind of a sort of a brief overview of what we talked about. I don't know if anybody has anything to add to my summation.
I just wanted to say great job, Andrew. And if you have some time later today, we can discuss on how to improve the work of the council with advocates. So I'll just call you later today and we can discuss. How about that?
Okay. Sounds good, Kevin. Thank you.
Thank you very much, Andrew. It's very unfortunate, but three of our self-advocates were not able to join us today. But we did have two of them were able to participate in the caucus. So again, thank you, Andrew, for the report. For the executive director report.
Thank you, Paul. And you know, I first want to start off by saying that being able to work with all the council members over the last 9 months has been particularly significant in that I know that everyone is dealing with personal situations and the effects of COVID on their personal lives and their jobs. And we have certainly not had a slow point throughout. And I think more recently, as we're all adjusting and settling into these times, we've actually really picked up a lot of steam. We're at a crossroad. We're in the final year of our current 5-year plan with 7 very ambitious and specific focus areas. And we are at the same time in the planning phase of the next 5-year plan. The current 5-year plan advocacy and family and self-advocacy goals have been accomplished. There's been much movement in what we had set out to accomplish in the first in the current 5-year plan, and in particular the work that is being done on charting the life course with our DD Act partners, the Boggs Center and Disability Rights New Jersey, and with DDD in assisting individuals and families in developing a framework around a good life. And the Family Support Planning Councils and advocates that have embraced that is really commendable. So the work that we're also doing and have done in the current 5-year plan with the direct support professional staffing issues, and soon we'll see an increase that the governor had included in his budget in January for direct support professionals, as well as direct supervisors of DSPs. Has been we've come a long way if you look back at where we were 5 years ago when this goal was initially included in the 5-year plan. Our special education advocacy, as Peg has very clearly articulated, has many issues that we are addressing, and I know that with her leadership, we will continue. We also have the SPAN project, which we are very excited to hear that they will continue to operate after our funding with Department of Education funding for training advocates to assist families in the IEP process. Employment, transportation, and housing have equally all had much attention and focus. And my full report, which is many pages long, will have more details, but this is just a short touch point. I know that on November 1st, the governor signed legislation overhauling the paratransit services and establishing regional paratransit coordinating councils, and council staff and advocates have played a significant role in providing testimony and supporting that initiative, as well as our housing program. Our housing objectives have taken a huge step forward. The project that was awarded to Shaw has now completed the Housing Navigator training program. Again, like Best Buddies, needing to adapt in order to complete that program by going from in-person sessions to virtual sessions that have yielded a significant number now of trained housing navigators in our state. And I would like to suggest that we have that Diane Riley at Shaw report at our next full meeting, as Best Buddies just did, to give everyone an update and a hand on that. Along with the ambitious 5-year plan, the Developmental Disability Advocacy Network, which the council supports, and all of its groups and activities. There are 8 specific work groups, and they have equally stepped up and taken on many virtual meetings and discussions and projects. You heard right off at the top of this meeting the work that the Developmental Disability Advocacy Network, or we refer to as the DDAN, has completed as it relates to employment and their advocacy there. We also have been supporting a survey that the Self-Directed and Person-Centered Services work group currently conducting on the New Jersey Comprehensive Assessment Tool. This week, the Medicaid and the Housing DDAN work groups met, and they both have a set of objectives that they're seeking to accomplish in the next few weeks, especially on the Medicaid side, with some discussions yesterday on generating a survey related to Medicaid and people's ability to access appeals and Medicaid decisions. So we are excited about the work that they'll take on. And the other subcommittees, or the work groups, I should say, of the DDAN equally have, if they have not met steadily, they have continued to push forward on their work group agendas. I think the most time-consuming thing that we heard a little bit earlier today has been the area focusing on the launch of the Legislative Disability Caucus. It has been a real honor and privilege to be able to move forward in an objective laid out earlier this year to launch a caucus of a bipartisan caucus of the Senate and Assembly, so that people with disabilities are raised to a level of knowledge, information sharing, and giving the credit they deserve in the supports and services that they access in our state, and how various state laws and policies and regulations and procedures impact their lives. So the fact that we will launch this caucus, we will support the launch of this caucus along with the partner agencies that Bob mentioned a little bit earlier, has been very rewarding. We hope that when the press release, the press advisory comes out next week, that you at the council level, and those of you watching this now on YouTube or will watch and view it later, will join in to the live feed of that announcement. We have a wonderful lineup of Senate and Assembly speakers that day, and we have a great lineup of self-advocates and family advocates who will briefly touch on the issues of importance and the work that that caucus will take on in the new year. Just checking my time here. Okay, so the next thing I wanted to talk about was some of the other advocacy efforts that have been going on kind of in front of and behind the scenes. There have been many, many opportunities for collaborative efforts that really further our advocacy and education goals as we've come together. Having great alliances with groups, our DDAC partners, the Ombudsman, our state agencies on and those, some of which are on this council and on this call, SPAN, the ARC of New Jersey, NJCDD, the Centers for Independent Living, Autism New Jersey, Shaw, and others have really moved us in a place where we not only are addressing the issues that come straight to us from individuals and from family advocates, but also that come to us through those affiliations with those other groups that we then can share out our information and bring their issues forward through direct input from those collaborating groups. So I continue to be impressed by how well our system is able to work together and achieve much more together than when we're not. Andrew mentioned the federal mandate under the electronic visit verification, and the past few weeks have been, I've been able to participate in 2 of the work groups established by the Division of Medical Assistance and Services, known as DMAS, known as the Medicaid office here in New Jersey, as this electronic visit verification is being rolled out. In particular, the work groups that I'm sitting on are the Family and Advocate work group, and then a separate work group around self-direction, self-determination. And just to take a minute, because I know that there's not a lot of public information out there yet about EVV, but it is a federal mandate through the Centers for Medicaid and Medicare Services that will go into effect January 1st of 2021. At this point, there is no indication that that date will not move forward. And the construct behind this is that the federal government in Medicaid spending for personal care and in-home care services is looking to ensure a number of components exist when a home visit is provided. That the type of service is identified, that the individual receiving the service is identified, the date of service is identified, location of service is identified, as well as the individual providing the service and the time that the service begins and ends. And the way that the government is looking to do that is through an electronic verification system, as the title says. So if someone is to come into a home and provide a personal care service, that staff person will need to complete a process whereby those items that I just mentioned are verified electronically, submitted to a state clearinghouse that validates the work has been performed, and that we can then comply with electronic visit verification mandate. There have been many discussions at that level, and I can assure you that from what I've heard from individuals, in particular the caucus of advocates on the council that have met, that was one of the first conversations that they had at our last meeting, where they laid out some very important questions and concerns about the lack of information currently available and the unknowns that currently exist around a system that is going to affect their lives in just a few short weeks. And family groups that have met and made sure that they've expressed their concerns. They have been brought to the 2 work groups that I sit on, and I know that other families and advocates.
A participant has left the meeting.
To the discussion. So more to come. The council will make sure that we share any information as it becomes available across our listservs, and we know that everyone else will share as solid information is presented. The other thing I wanted to add is that this week we also released a report of a committee that I have been participating in early on in the COVID period.
A participant has joined the meeting.
That is called the Disability Action Committee. Their initial report was submitted, a press release was submitted, and that is now available on our website and was distributed this week. So that those were the highlights. There is a Family Support Planning Council meeting this Saturday from 10 a.m. till noon, and it will have 3 state speakers, including John Seafried at the Division of Developmental Disabilities, Damian Patino at the Department of Education, and Molly Green from the Children's System of Care, It will be a format like this where you can live stream on our YouTube channel, or the Family Support Planning Council's channel, and you can participate via the chat on that platform. So we encourage anyone who would like to hear from those 3 state representatives to tune in or go back and view the live feed of that meeting. And so that's it for now, Paul. I do have the next agenda item, so I don't know if you want me to just keep going. Okay. Okay. So next on the agenda is the council meeting calendar of public meetings and committee meetings for next year. It was included in your packet, so please take a look at that. All of you serve in some way on one of the committees that we have. If you are see a committee that you want to participate in, I know that Paul will be happy to appoint you to that committee. But we did attempt this year, given lots of meetings and not really being, seated at our offices for the most part. We wanted to make sure we provided in one place a list of the committees for the year. So it starts with the council meeting schedule, and I think that this would be the opportunity to review that and make sure that there are no major conflicts that we are not aware of, that we should be aware of. And my list is somewhere here on my desk. Okay. So our council meeting schedule for next year is February 11th, May the 20th, August the 5th, and November the 18th. And they are all from 10 a.m. until noon. So maybe I'll just pause for a moment there. Paul, you're on mute.
Point, still hope that by November and hopefully even by August, we could meet in person. Obviously, we're not going to be able to do that in February, and I doubt we'll be able to do it in May.
Correct.
Just 2 quick questions. One, if we do manage to have any meetings in person, we would adjust them to be a little longer, correct? So we
Yes.
Okay.
Yes.
Second question is, could you email or have to send the email those dates to the council members one more time so I can schedule them on my calendar?
Okay, so they were in your full packet, but Jacinta will be resending them after we meet today to ensure that there are no changes. And we also now have the dates for the ad hoc committee on equal access to DD services. So she will be emailing the full schedule of meetings out to all council members after today's meeting. So those are the council meeting dates established. We also have the council advocate member caucus meetings established, which we're going to go back to just the Wednesday night before the council meetings to keep it on a steady schedule. And so those dates are February the 10th, May the 19th, August the 5th, and November the 17th, again, the evening before the council meeting from 6 to 7 p.m. We also have the schedule laid out for the executive committee meetings. I'm not going to read all these because these become much longer lists, but executive committee meeting dates are set for next year quarterly, as well as state planning and grants committee. They will meet on the same day, and just when one meeting ends, they'll move into the next because all those members are consistent, and those dates are laid out monthly for next year. Public policy committee meetings have been set by Helen, and they are, I'm sorry, by Kara and Andrew, and they are included here as well. And they will meet 6 times next year. They had met 8 times in the last calendar year, but they're going to move to a 6 meeting schedule. Children and Youth has been steadily meeting the second Friday of each month, and that calendar is also included. And the Health and Wellness Subcommittee will resume its meetings beginning in January as well. And then I'll just reiterate that the Equal Access to DD Services Ad Hoc Committee, those meetings have been scheduled and will be included in the second round. So are there any questions on that schedule or comments?
It's Elizabeth. I just noticed there's an error on the caucus meeting. It should be August 4th, not August 5th.
Thank you. You got that, Jay? Okay, thank you, Jay.
Okay.
And then the other meeting that is not on here that I wanted to make sure we had a discussion about was the state plan committee to review a draft for the 5-year plan. Jacinta had sent out a list of possible dates, and it seems that there was a real separation in family and self-advocate council members availability and non-family self-advocate council member availability. But the date that had the most consistency was Saturday, January the 23rd from 10 a.m. until noon. If that is the date, that you intend to proceed with, we need to begin, the planning around the distribution of materials and solidifying that as many of the council members as possible can participate in that very important discussion. That is a retreat, a virtual retreat meeting, as I understand it, because I wasn't here at the last 5-year planning, that was a 1.5 day process that had taken place in an offsite location to review the draft 5-year plan. This is a much different environment that we're in, so this would be a 2-hour virtual retreat. And I just want to make sure that there is a full understanding and setting of that date in motion before we move forward. So I'll let that be your discussion.
Pardon me, Mercedes. Can you please repeat for my benefit and perhaps the benefit of the council, the date for the retreat?
Yes,
Please.
Saturday. Yes, thank you, Andrew. Saturday, January 23rd from 10 a.m. until noon.
Thank you.
Is there any discussion on that, or are we just going to move forward with that date so that we can begin the planning?
As long as I know in advance, I'll be fine. A Saturday is not thrilling, but I'll make it work, and I'm sure all of us will for this particular need. So that gives my 2 cents. But with enough notice, I think we can make it work.
Okay, not hearing any objections. I think we can establish the January 23rd date. It's very difficult to get everybody together. And Saturday seems to be the day that will attract the most people. But again, I really request that everybody think before January 23rd of what ideas they want to bring to the table in the areas of their greatest interest. We don't want to be in a position where we're time pressed at the end. I think the planning committee has done an outstanding job of getting an early start and establishing a realistic timeline. But again, we want to make sure that everybody gets a chance to speak and everybody gets a chance to offer their ideas and their experiences. Okay. I want to go back and I want to thank Jonathan, Jackie, Phyllis, and Kim our state agency representatives taking the time to join us. I also want to thank Gwen and Paul Aronson for being with us. And I want to also give special thanks to our new policy committee chair and co-chair, Kara and Andrew, and to Sophia for taking on the responsibility for chairing the ad hoc committee. I'm sure everybody joins me in thanking you. And of course, it goes without saying that I want to thank all the ongoing council chairs. I think, the committees have done a terrific job. You've all, stepped up. And I could say that about everyone. Peg has been a dynamo, very effective at, resuscitating and reestablishing CNY, which had been a moribund education committee. The policy committee under Ellie and now Kara has done a terrific job updating really outdated policy papers that we had on the website. If you look at H&W, the two projects that were completed, the medical resident curriculum and the oral care project are just, far beyond anything that the council had done previously. So, our thanks to everyone, and of course to Kevin, who, as I said before, is just always available, reads every application that comes in for in response to our RFP. So thank you to everyone, and I really want to thank the self-advocates, even though some of them are not here today. I know it's been very, very difficult for them to manage the pandemic, and we appreciate their participation in our activities. We have an uncharacteristically large number of public comments. Let me go to them, and I'm going to start from the first. Let's see. Okay, Norman Smith, the New Jersey Statewide Independent Council has endorsed the changes to workability program. We will take a serious look at it. By not doing anything today, I don't mean to indicate that we're not going to support it, just that we have to follow procedures, and we have to make sure that it's discussed and voted on. So we're referring it for discussion to the Public Policy Committee, and since the council will not meet soon enough, we'll do a final vote at the Executive Committee, so we can get this done as quickly as possible. I've got a comment here. I'm not sure that I've got the whole thing. This is from Daniel Barrick. I'm an independent living specialist at Dawn Center for Independent Living. Daniel, thank you for joining us. We appreciate that. Walter Kalman, would the council like to make a statement of concern in a nonpartisan manner, commenting on the successfully completed election? Walter Kalman, while confronting the challenges of the pandemic about efforts to disenfranchise many voters, many of whom are people with disabilities facing even more challenges in exercising their right to vote. I think this is getting beyond our expertise. I would just personally say that I'm delighted that we had a record number of people voting. I think democracy works best when, I'd like to say everybody, but certainly when more people vote. I think you get both a better result and more confidence that the people spoke and got the decision that they wanted. Okay. Monique Wilson asks if everyone is confirmed, or just possibly Sarah Aziz. She says, I'm confused. Monique, I'm confused also. As far as we know, only Sarah has been confirmed by the Senate. but we have not received, nor has Sarah received any confirmation from the governor's office, and I'm not really sure what has happened here, and we haven't been able to get a response from the governor's office of appointments. I was told that the person who is responsible for this is on leave of absence, and we keep making inquiries, and I'd like to thank Paul Aronson for all the assistance he's given us in trying to connect us with the governor's office of appointments. This is very perplexing, not just for Sarah, but we really need to fill the now 7 empty seats on the council. I know the governor appears to be taking the tack that he would prefer to nominate people who have been recommended by their state legislators. So again, for people who are interested in becoming council members, my best suggestion is that you contact your state legislators, probably best your state senator, and ask your state senator to submit a recommendation to the governor's office of appointments. Monique, again, can you please provide the bill number mentioned by Peg? Peg, do you want to respond to that?
I don't know if Peg's, I see Peg there. I don't know if I know she was having some issues. I found the Senate bill number, and this was on the bridge year funding pilot. Oh, Peg, can you there?
Yeah, I am having so much trouble with this WebEx today. I don't know why. I sent you I sent Mercedes the bill number. It's, hold on a minute. Sorry. Yeah, where'd I put it? Look, hold on.
I found it in my emails, Peg. It's Assembly
Okay.
5025.
Right.
Assembly Bill
So
5025. And I think Senate 2383. At least that's what I found on my own.
is that the first bridge bill or the second? I didn't know if there was a Senate companion. No, that's the old one.
Oh, that's the old one. Okay, so A5025.
Right. This is to amend that bill because that bill only had up to age 19. So it was not inclusive of students with disabilities who stayed in school till 21. So right now, go with the A bill. I don't know that there's a Senate companion. I haven't found one yet. Doesn't mean it's not there, but right now, and it was just introduced yesterday, I believe. So.
And was the school safety bill also introduced today as well?
Not that I know of.
Oh.
But that one's out. That's been out there floating anyway. So, I don't know that they're going to do anything about that right now because of the schools and the circumstances they're working under during COVID. Not that they shouldn't, but that's just kind of the way it is.
Okay. Okay, we have several more comments from Monique. Current bylaws seem to deny access to voice of those not committee members. I'm going to assume that she meant council members. My point, the same voices. Is this open to new voices? What about public members who are interested? The council has been established, mandated, and funded by federal legislation and the Congress of the United States. All council members are nominated by the governor of the state of New Jersey and are subject to confirmation by the Senate of the state of New Jersey. We have responsibility to uphold the requirements of the federal law and mandate and to report to the Department of Human Services, Health and Human Service, HHS, on our progress in carrying out our responsibilities and how we have spent the federal funding that we have been given. We also report to the state of New Jersey since we get partial funding from the state and of course are responsible to the governor. As I mentioned, there are vacant seats on the council. Members of the public are certainly invited to apply to the governor's office of appointments or get a recommendation from their state senator. We certainly would welcome a full complement of council members, and we have struggled largely in vain, it would appear, to fill those seats. The governor made appointments or nominated people last year, and the Senate did not take action. So this is not, the governor did his part. The state Senate did not take action. So we try to get the people renominated, and hopefully the Senate will take action. But certainly, members of the public are invited to seek membership. We do not appoint members. It has to be done by the governor's office of appointments. Nantony has another comment. As Kevin Nunez has stated at the beginning of the meeting, there is some urgency in our receiving as much support for legislative reform to expand access to New Jersey workability as soon as possible. DDEN members and other advocates have already submitted our requests and letters of support to a couple of legislators. We stand by to provide the council with any additional information to achieve our goal. Thank you. Nantony, this is a very high priority for us. I know Kevin has been leading the charge for matters to improve the prospects for employment for people with developmental disabilities. We just have to follow our bylaws, and this has to be voted on by either the full council or the executive committee, and this will be done as quickly as we can. We fully understand that time is of the essence. I have a couple more comments from Monique, and I really appreciate these. Sophia Mohammed, great start to beginning a difficult conversation that is long overdue. Thank you, Monique, for recognizing the quality of the work and the commitment of Sophia. Sophia has responded. Thank you, Monique. Appreciate that. We must get comfortable with being uncomfortable. Well put, Sophia. Monique, I think this is, this is another comment. And ensure the conversation does not stop. It's not new issues and surely bigger than a 5-year plan. We cannot solve all the social issues in this country. What we're trying to do is make sure of two things. One, that we contribute to improving access to services for people who have been largely underserved or ignored, and making sure that everything in our 5-year plan includes populations that have been excluded. And that really is the underlying rationale for the legislative caucus. We want to make sure that things aren't just done, and then as an afterthought, we have to say, well, this law or this bill or this proposal in the legislature doesn't include the needs of people with disabilities. We're trying to make sure that everything that we include in the 5-year plan gives equal access and equal consideration to all groups of individuals with developmental disabilities in New Jersey. So I commend the ad hoc committee and the members for participating. I welcome your assistance, your suggestions, your advice, and I fully anticipate that you will hold us accountable over the planning period for the 5-year plan and for the 5 years as we carry out the plan. Let's see, Monique.
Paul?
Yes.
I'm sorry, I just want to clarify for everybody.
Sure.
Assembly Bill 5025 does not have a Senate companion yet. It only has one sponsor. So if we think expanding the age in that bridge year pilot is important, we're going to have to put that on the list
Okay.
for everyone listening and those associated with the council.
Yeah. Okay.
And I just want to add one other thing, on my update from before. The Keeping All Students Safe Act has been introduced, and it's got sponsors on both the Senate and House side, but it needs more push. So, that's it.
Okay. Monique, it would be inspiring to hear some of their success stories. Where can I find them? Referring to Charting the Life course trajectory. The Charting the Life course trajectory is a joint project of the Division of Developmental Disabilities, the Box Center, and the Statewide Family Support Planning Council. Our contact person at the council is our staff person, Rebecca Novemsky. We have a subcommittee of the Statewide Planning Council that works with Rebecca, with Colleen McLaughlin from the Box Center, and with Tricia Brennan from DDD. I think we're, and again, maybe I should refer this to Rebecca. And if you're on, Rebecca, please speak up. We're kind of early. We're introducing the process through the 10 family support planning councils, and hopefully they will be able to spread them out to families and self-advocates in our in the 10 regions. But I think we're still fairly early in the process, but my sense is that the effort has been well received. Certainly in Council 5, it certainly seems to have been well received, and I would presume, although it's always dangerous to presume, but I would assume that it has been well received in the other regional councils. Do you want to expand upon that, Rebecca?
Just that Regional Family Support Planning Council meetings are open and public meetings, and that is where we are introducing the tools to be used by families. So any family that wants to participate, please contact me for your local regional meeting, and you are more than welcome to participate. And the website lifecoursetools.com is where all the tools can be found, and they are available along with videos and instructional booklets to explain the tools if you're interested. And you can always contact me, Monique, of course.
Thank you, Rebecca.
I just wanted to say real quickly.
And I should
Sorry, Paul.
mention that Rebecca has been joining each of the regional councils to help introduce the program and to help us learn how to use it. So thank you very much, Rebecca. One final comment from my good friend Monique. Perhaps in your bylaw review, you will reconsider the times you meet, not really accessible for individuals and families who want to participate. I don't know exactly how to respond to that. Ever since I've been a council member, the meetings have been held on what is it, the third? Is it the third Thursday of a month in the morning? I realize that that is a difficult time for people who are employed. On the other hand, I have never sensed a great deal of enthusiasm for doing the in-person meetings in the evening. So certainly it's a point that is worthy of this discussion. We could, I presume, consider the alternative of holding meetings on a Saturday morning. Again, I don't know. That may be imposing upon the state agency representatives, our sister agencies, and council members who are employed all week and really have to take care of their families on the weekends. I'm certainly open to suggestions from council members or members of the public, and we can always do a poll of council members if they want to consider changing the meeting times. That's certainly open for discussion. And again, if anybody wants to consider changing the day of the week or the time that we meet, I suggest you contact Mercedes and let her collect those suggestions. Did you want to comment on that, Kevin?
Yes.
Go ahead.
First of all, I'm open to all suggestions as we move forward. Especially, I think the council should have an ongoing outlet with our constituency and people that we represent. So I fully encourage all members of the public to constantly reach out to us and email our staff and our chair and vice chair with different ideas on how to improve. So I want to thank the public, especially for reaching out in this meeting. I think this is the most public comment we've had all year, so it really goes to show how the council has adapted to the new situation that we are all living in. And in regards to the time, I'm not opposed to having a discussion when we look at the bylaws and those kind of things to be flexible with our community.
Thank you, Kevin. Yeah, I mean, these are things that are not engraved in stone. I'm very gratified that we've had so many comments. We do welcome, and I mean that sincerely, we do welcome public comment, whether they're suggestions or critiques. Clearly, if we're not doing what you think we should be doing, you should let us know that. We're not looking to waste our time. As I mentioned earlier, we're here to inform, empower, and represent people with developmental disabilities and their families, and we really can't do that in a vacuum. We need the support, the advice, the criticism, the suggestions of the public. We consider the public to be the people we're working for. I realize we're not getting paid, but we still work for you. We're not doing this for ourselves. We are all committed to making the system work better for everyone. And we use our knowledge, our experience, the resources we're given by the federal government and the state government to try to move the system in a positive direction. But again, public participation not only is welcome, it's absolutely essential. Anyway, that I think completes the agenda. I'll throw it open one last time for any council member who wants to provide a comment before we adjourn.
Paul, will the date for the caucus, the January date, will that be going out with the full calendar of meetings for next year? You know, that piece of virtual paper, as it were, for next year?
Yes.
Yes, it should be there.
Yes, it's on the list already.
Okay.
Thanks, Andrew. We'll send it.
Sure. Thank you.
And we look forward to your participation. I thought that the caucus was wonderful. I mean, I was going to say you guys and one gal were very, very good. You spoke from the heart, you spoke from your experience, and demonstrated a great commitment to the council making life better.
Thank you. Thank you for that opportunity.
Again, it's my apologies. We should never have stopped doing it. Okay, well, I want to thank everybody who participated in this meeting. I wish you all a wonderful Thanksgiving and December holiday season. And please remember the January 23rd. That's a very important meeting. I know I'm not exactly sure what a virtual retreat is, but I anticipate a very productive meeting. Helen and Brenda have really done a lot of work. We've gotten a lot of comments from the public. This is something we never had before, so we really have gotten a broad spectrum of input, and I'm very optimistic that this is going to be the best 5-year plan this council has ever authored.
Paul, could we get a motion to adjourn, Jay, please?
Okay. Kevin, I usually can rely on you for these things.
Yes. Before I do so, I just want to encourage anyone who's interested in advising on the bylaws to please reach out to Paul. With that being said, have a good day, everybody. And I want to issue a motion to adjourn the meeting.
Thank you, Kevin.
I'm happy to second that. It's Elizabeth.
Thank you, Elizabeth. Hearing no objections, I declare the meeting adjourned.
Bye, guys.
Bye, guys.
Happy Thanksgiving,
Take care.
everybody.
Happy Thanksgiving.
Thank you.
Bye, everybody.
Everyone.
Bye-bye.